So good evening, everybody. My name is Timmy Frawley, and I'm a member of the UCD Neurodiversity Working Group. I'm delighted to be here with colleagues from the College of Health and Agricultural Sciences, Bet, and also Ken from Adhd Ireland. It's really good to have you here this evening. But we're here to speak specifically with our guest for today, and that is Mr. Aidan Healy of Lexxic. Aidan is a business psychologist and CEO of Lexxic. And I think it's fair to say that Aidan is on a mission to create a working world that includes and empowers all neurological differences. He has 15 years of experience in people development roles, holding qualifications in psychology, leadership development, and coaching. He is also the co-chair of the Neurodiversity Task Forces for the British Assistive Technology Association, the Business Disability Forum, and the Employers Network for Equality and Inclusion. Lexxic, perhaps some people have heard of Lexxic, but Lexxic are leaders in the field of neurodiversity in the workplace. As a specialist occupational psychological consultancy with a 14-year track record, they partner with over 200 organizations each year to empower neurodiverse talent and reshape their workplace culture. And certainly, this is an area which interests me greatly because I'm very keen to see a workplace which welcomes and facilitates, empowers and encourages all people, irrespective of background. And certainly in my own work in the College of Health and Agricultural Sciences, from a nursing, midwifery and health systems background, I see on a day-to-day basis how important this is. So I'm really looking forward to hearing from Aidan this evening, as I'm sure you are. So without further ado, a big welcome to everybody who's watching us here live or who's watching the recording, and I'll hand over to Aidan. Thank you.
Good evening, Timmy. Thank you very much to the introduction, and hello to the 85 people here. I have said hello in the chat. It would be lovely if someone could say hello back. It's always nice to hear from you. Thank you very much, Sophie, for saying hello back. It's always nice to hear from you. You know, what brought you here this evening, what questions you have. I'm going to speak for about 20 minutes, and I'm going to give you quite a bit of information. And I guess what I'm really looking forward to kind of interacting with you, taking your questions, because I think that's really where the value add is. So please do send me your questions, your challenges, your heckles. Lovely to see people from internationally and from all over the world. Thank you so much for all of your hellos in the chat. So look, today's session is really about neurodiversity in a workplace context. And I think this figure really struck me. It's LinkedIn data from September. And I think it's showing the subject of diversity, the subject of disability is really becoming more front and center for so many organizations. But I think when we talk about embracing diversity, we're often missing a group of individuals. We're missing a characteristic. And I think this group, because their differences may be stereotyped or invisible or hidden compared to some other differences, they don't always have the voice of other groups in organizations. And I think as a group in Lexxic, we really believe they can contribute so much to performance, creativity, and innovation within organizations. And so, you know, I think when we talk about diversity, a lot of us have this idea of an image on the left going to an image on the right. You know, we think of visible disabilities, we think of race, we think of gender. And I think if we ask any modern workplace leader, business leader, why should we get D&I right? They'll probably start with, well, it's the right thing to do. And of course it is. You know, there's obvious synergies between an ethical, caring business practice and a good D&I strategy. But I also think when organizations get D&I right, there's massive organizational opportunities, whether that's capitalizing on diverse perspectives, appealing to a new talent pool, painting a more modern brand. There are real organizational benefits here. And D&I, similarly done badly, isn't just embarrassing, it's actually detrimental to business. I think poor inclusion strategies, poorly considered communications have the potential to cause real offense, tribunals, and even media backlash in some instances. So I think when we think about diversity in the workplace, we think of gender, we think of Me Too, we think of Black Lives Matter, we think of LGBT. But I think we all know that if I asked you, what makes you who you are, or what kind of work do you enjoy? What kind of work do you find challenging? We also know we have a personality. We have a way of being in the world, right? I'm using DISC here as an example, but there's others like Myers-Briggs and StrengthsFinder and so on. And most of you at some point in your career have probably been through some kind of personality profile that says, you know, if you were in a meeting and you are a very strong red, and I said, I would like you to organize a webinar next month, you would be on the phone, you would be sorting it out, you would want to get it done as quickly as possible. You're not as interested in the plan or how everybody feels or forming a committee, you know, let's just get this done. Whereas if you were a strong blue, you would think about, well, we need to look at this webinar in a systematic way. We need to draw up a project plan. We need to consider dates, times, budgets, who's involved. We need to consult. We need to do all of these things. But I think what's important about personality is we don't see one as being better than the other. And I think we all know a strong organization, a strong team needs different types of people. So when we talk about neurodiversity, when we talk about being neuro-inclusive, we're talking about different types of brains. Neuro is really a shorthand for neurological differences. And there are many neurological differences. There are many ways you can be neurodiverse. But this is an example of some of the common labels or differences that we talk about when we talk about neurodifferences. The statistics here really do vary depending on what study and what data and how you include and exclude, but generally the community has settled on about 15 to 20% of the population. So when we think about this in an organizational context, you have people in your organization with neurodifferences. They are your employees, your future talent, your customers. And yet, if I was to open up your people strategy, your D&I strategy, your disability strategy, we can see here data from CIPD that most organizations don't include neurodifferences in their people management practices. They don't include neurodifferences when they're talking about D&I. And I think in Lexxic, what we're doing is we're working a lot with individuals in HR, in D&I, employee resource groups, who kind of present a passionate case to their senior leaders or to their board. And they often get questions like this, right? Where's the best practice? What's the ROI? What's the business case? Where's your data and evidence? And I think sometimes when we lack this kind of value-based language or organizational-based language, tell me if this sounds familiar. How about we fund some awareness sessions? How about we fund a lunch and learn? And I fully understand why words like business case and value proposition can sound frustrating if you have a neurodifference, because you're probably thinking, well, what's the business case for white men? What's the business case for Canadians? It sounds slightly off, but my only observation to you, having spent many years working with corporates, with public sector bodies, we've got to try and explain what's in it for them as an organization, because most organizations and most leaders, when it ultimately comes down to it, They want to know what's in it for me. So as Timmy said, I'm the CEO of Lexxic. We're an organization with 14 years experience in neurodiversity in the workplace. We were founded by a dyslexic individual, really after experiencing her own challenges in the workplace with kind of two big ideas. One, to bring the life-changing support she received to as many people as possible. And two, I suppose, to really look at this in an organizational context. So the title of this session is Developing Your Neurodiversity Strategy. And I just want to talk a little bit about where strategy sits for us when it comes to your organization. So generally, neurodiversity gets taken off the agenda for a number of reasons. There's a lack of executive buy-in, so your strategy doesn't align to your organization's vision, mission, and objectives. There's a lack of an operational plan, which is maybe your senior leaders are bought in, your CEO posts something or holds an event and says, this is it for 2022. There's no operational plan. There's no tactics. There's no approach. So for us, strategy is really critical and kind of sits in the middle of that executive buy-in and an operational plan. And look, when it comes to strategy, just to be very clear, there's no one best way. Every organization is different. Every organization starts differently. But we can see some common trends when we see organizations get this right, and some common trends when we see organizations get this wrong. And I'm going to talk briefly about 5 of them, and then I'm going to take as many Q&A points as possible. So I think the first reason we often get it wrong with neurodiversity is we talk about deficits instead of differences. I will give you an example of this. This is a line manager toolkit produced on neurological differences. And this is what they say, what you can expect as a line manager if you are managing someone with ADHD. And as you can read through this, I hope you're seeing what I'm seeing, which is there is almost nothing positive here. It is all entirely negative. And we really have to start with, this is data by the charity Made by Dyslexia, looking at members of the public's perception of dyslexia versus dyslexic individuals themselves. And what do we see? If you look at the bottom 2 rows, you can see relative alignment between the challenges of dyslexia, but we talk about the strengths of dyslexia, there is a really, really big gap. And so when we're talking about neurodiversity, I think we're really talking about 2 sides of the same coin. That if you were to think about who you are and your personality, what are you like on a good day and what are you like on a bad day? Another way to think about this is think of the characteristics of your husband or wife. The thing you really love about them on a good day, that can also be a bit of a challenge about them on a bad day. And I think, to go back to ADHD as an example, context is everything. The environment is everything. The adjustments we put in place are everything. Aligning someone's strengths to the right role becomes everything, because someone who is easily distracted in one environment can actually really, they're jumping around, they're looking at different things, that can really lead to much higher creativity. Someone you might feel is fidgety or always moving around can actually be highly energetic and work very hard in the right environments. Or someone who is impulsive, actually, if your organization needs to make decisions quickly, that can be a really positive environment for them. So when we're talking about neurodiversity in a workplace context, we have to move away from this kind of deficit, charity, poor them, it's the right thing to do. We have to look at differences the same way we value differences in gender, in race, in sexuality, in disability, in age, and so on and so forth. And I think the organizations that are getting this right or are more progressive are really talking about the value of neurological differences. I'll give you an example here. This is a report from EY on the value of dyslexia. And if you go back to those kind of strengths and challenges of dyslexia that I showed you a few slides ago, in a world of DocuSign and Siri and Cortana and Alexa, is a child born today really going to be writing in a copybook or, text to speech or so on and so forth? And what EY is saying is actually these skills that our education system is valuing right now aren't the skills of the future. But if you think about those skills of dyslexia, the creative thinking, thinking laterally, thinking differently, these are the things an organization will need. And similarly, when we look at the challenges of a lot of organizations where things go wrong over the last few years, we hear again and again this idea of groupthink. If that feels a bit too woolly and qualitative for you, here's an example. This is Anthony Pacilio from JP Morgan's Autism at Work initiative. And he's very clear here. He's saying, look, this is not charity. This is not about numbers. This is about talent for the firm. And we recognize that fully. And I do want to be very clear here. Anthony Pacilio is not saying, and I'm not saying, everyone on the autism spectrum is going to be 48% more productive, or a great coder, or Rain Man, or a genius, or whatever the classic stereotypes are. But what we can see when it comes to the workplace is people have certain challenges because they think differently, and some of the things that come naturally to you may be challenging for them. But because of those differences, it really brings them some great strengths. So that's number one, differences and not deficits. Number two is actually thinking about your adjustments policy. And I'll tell you why this is important. One of the common challenges people with a neurodifference face is they will walk into their line manager's office and they will say, I think I may have dyslexia, I may have ADHD, family members have said it, friends have said it, teachers have said it, I've read a bit about it online, it might be impacting my work. Well, what do you think I should do? And most organizations, the answer to that is, we have no idea. And so you might go to your GP, you might call a national charity, you might call Lexxic, you might go to your occupational health provider. And I think this is really important in the context of organizations, because when employees have a negative experience of your workplace adjustment support and process, the consequences are really quite significant. So relationships between the employee and people managers become distrustful, people become frustrated, employees may go off sick, but really they lose trust and confidence in the whole inclusion and people agenda. And similarly, when they go off sick, what happens? Tasks go unfulfilled, customers and clients see the impact, agency staff are brought in, there are real consequences here. And similarly, we can't bury our heads in the sand when it comes to adjustments, because under the Equality Act, this is the UK Equality Act, but globally it's very similar, neurological differences are often categorized as disability. That's because the law doesn't categorize disability by a list of conditions. It categorizes it as a long-term physical or mental impairment, and therefore there's a requirement and duty to make reasonable adjustments. So many people with neurodifferences, when it comes to a legal perspective, will qualify as disabled, and there is a real duty of care there when it comes to making positive adjustments. Third thing I want to talk about, I suppose, is organizational culture. And what we say to organizations is, look, before you start with your management training program, your big conference, your big event, think about your adjustments policy for individuals. Think about your referral processes. But I think it's very important, and if this was a kind of a line I would hang above every HR director's office, I would, which is adjustments do not remove barriers to inclusion elsewhere in the organization. So you can give someone a larger computer monitor, a text-to-speech software, noise cancelling headphones, but it won't remove barriers like the attitude of that individual's line manager, comments from colleagues, access to L&D opportunities, opportunities for promotion or progression, or even that kind of feeling of being psychologically safe or being included. So when we talk about culture, we can see here very clearly data from the Institute of Leadership and Management. Many line managers don't feel they have the tools. They don't feel they have the skills to line manage someone with a neurodifference or have a positive conversation around neurodifferences. So we really have to start with training, with education, get your senior leaders talking about it, set up employee resource groups. Culture becomes such a critical part, I think, of an organization's inclusion journey. Fourth thing I want to talk about is this idea of systemic change. So let's say you have a good adjustments process in place. Let's say you have done some training and education. There's also systemic barriers we have to look at. And what we really see with organizations is sometimes organizations kind of dive into this with a clear goal in mind, right? They kind of say, well, we want more women, we want more BAME, and we want more neurodifferences. And I think what the challenge is goals often have an endpoint. So have you ever met someone, or have you ever, worked up to run a marathon, then you run the marathon, you achieve your goal, and then you stop exercising altogether? This is a lot of what we see in organizations. So when we're talking about being inclusive, it's really important to look at our day-to-day systems. And I think there's three common areas we're seeing organizations invest in now, which is the first is the recruitment process. So looking at how recruitment can often be a barrier to entry, the traditional CV interview reference check for many candidates with neurodifferences. I'm happy to answer many questions on that in the chat. The second is the actual physical workspace. This is an example from BBC Cape, which is called Creating a Positive Environment. Again, looking at things like lighting, sound, your buildings checklist. There's a new ISO standard coming out from the BSI in relation to neurological differences. So we have to think of our office environment as well. And finally, I think in this section, what's important to say is, if I'm thinking of working for you, if I'm thinking of sharing my story, if I'm thinking of, talking to my line manager or submitting an application, how do I know you have a positive attitude or culture or are welcoming to me with a neurodifference? And this is where you do have to blog about it, create content about it, create policies about it, because many people, this is their first stop. So very important in point 4 to think about the systemic barriers. There's no point saying we welcome people with neurodifferences, but there's no adjustments in our recruitment policy. You have to work in a specific office, and actually we have no positive communication where you can find out if we're actually neuro-inclusive or not. And the organizations that are investing in that are certainly much further ahead. And number 5, I think the final thing I would say in relation to developing a neurodiversity strategy comes from demonstrating results. I think when we talk about neurodiversity, when we talk about D&I initiatives, so often we find with our clients that they lack the kind of KPIs, the kind of outputs, or even focus on the wrong ones compared to many other things in the organization. So a lot of our work with organizations is actually building a set of measures, a set of something you can point to show that that initial investment is a success. And really, once you can do that in a smaller budget or a smaller scale, it makes it so much easier to actually then ask for more funding, ask for more resources, ask for more staff. And I really do believe in the kind of old management dictum, what gets measured gets done. And D&I initiatives and your initiatives should not be any different. So that is some thoughts. Let me try and wrap all that up, and then please do fire questions in the chat and the Q&A. Firstly, I think when we look at an organization being neuro-inclusive, it is a collection of a number of things. So it is individual change, which is your adjustments policy. there's kind of a collective, your line managers, the people around that individual. And for that, I would say there's your adjustments policy, your organizational culture. And really, when you're communicating about neurodiversity, focus on differences, take a balanced view of strengths and challenges rather than thinking about deficits. And I think when it comes to systemic change, think about things like your recruitment, your building design, your communication, and really think about actually, how do we hold ourselves accountable to what we're investing, and how do we really demonstrate results? And look, in conclusion, as I said at the beginning, this is 15 to 20% of your workforce. This is your employees, your future talent, your procurement, your supply chain, your customers. You know, I really do feel, in talking to people with neurodifferences every day, they have so much to add, they have so much to contribute, and we really let them down by stereotyping and stigmatizing them and saying this is the only way to work. And I think the organizations that are investing in that now are really going to reap those benefits, and the organizations that are putting their head in the sand, I think there's a real risk of being left behind and a real risk of this impacting your business. So thank you very much for listening. That was a little over 20 minutes, but really happy to take as many questions as people have for me. Timmy, maybe back to you.
Sure. Aidan, thanks so much. And you know, there's a music band called U2, and they have a song. I still haven't found what I'm looking for, but I think actually I have found something that I'm looking for here this evening. I really enjoyed your talk. And just, if I may, a couple of very quick questions from myself, and then we'll open to questions from everybody. I really liked your slide when you spoke about differences as opposed to deficits. And you also spoke about challenges and strengths. I'm just wondering, how can we ensure that we better match strengths to roles in the workplace? How can we get a better match between the strengths that I might have or anyone else might have to match with the role more than maybe we do?
Sure. I mean, I think there's a few things I would say on that. Number one is it should start with your recruitment processes. I really feel like, you know, the job interview is so often not designed for actually assessing a candidate's ability to do that job effectively. So, you know, if you are hiring a computer scientist, in my opinion, an effective way of seeing if they're going to do that job or not is to give them a bunch of broken code and see how quickly they can fix it. But, you know, if you're hiring a psychologist, then you do need to focus on rapport and their ability to build rapport with others. So I really do feel our traditional recruitment processes are often letting us down in that. And then I think for me, the conversations we encourage managers to have is just, you know, what are your strengths? What are your challenges? What do you look like on a good day? What do you look like on a bad day? Talk me through this job and tell me what you enjoy about it and what you don't enjoy about it. And to have that conversation openly. And I would say this about our work in Lexxic, you know, we're often brought in to help a person succeed at work, or we're often brought in maybe sometimes in a performance management process. It's not a failure of that process to say to an individual, look, this role might not mathematics. You can give me all of the coaching and training and reasonable adjustments and whatever you like. I'm never going to be a great accountant and love being a good and love accounting as a practice. So, you know, I think it is about having conversations, thinking about our recruitment processes and being willing.
We seem to be losing you a tiny bit, Aidan. So Aidan, on my end, I just lost the final bit that you were saying, but hopefully everyone else heard you. Just one final additional question to what you're saying. currently I do a little bit of work on job descriptions, hiring committees and so forth. And I'd love to know how we can improve the pre-application piece, how we can maybe send a message that's welcoming, that when people look at that job advert, maybe on a site, that it's more inviting, because currently I think some people are even put off before getting to interview. If you've any comments on that, I'd love to hear them. And then I think we'll hand over to Beth and Ken and make sure we get as many questions as possible from the audience. Thanks, Aidan.
Yeah, absolutely. So I think one of the big challenges for many candidates with neurodifferences, excuse me, is how do I know if your organization is neurodiversity friendly or not? Or how do I know that I can actually share my story, or if I need an adjustment? So I think when we're considering hiring neurodiverse people, we should really first ensure our job descriptions, our websites include inclusive language, and also make it really clear your organization welcomes disclosure. They welcome people asking for adjustments. They welcome people contacting them to say, look, I actually feel I would really be my best if I could make an adjustment to the interview process, or here's something you need to know about me. So what I hear from candidates all the time is they go onto multiple websites and they go, well, I have no idea if this employer is neurodiversity friendly or not, so it's better to say nothing. I also think, we really have to look at job descriptions and think about what is required, what is preferred, and what is nice to have. I think some organizations are still really in the kind of more is better, and let's have kind of 15 pages of a job description with absolutely everything on it. So we, expect you to be highly creative, a really great communicator, a strong ability to work alone, all of these different things that actually often contradict each other. So if someone is reading your job description and, maybe they are dyslexic or they are autistic, if they see these things in the job description, it may make them apprehensive about applying, or they may not apply at all. So I would really encourage employers, when it comes to the pre-selection, think about the messages you're sending on your website and really think about your job descriptions. To take that example earlier, does an accountant need outstanding communication skills? I've worked with multiple accountants in our business over the years. It's not the first priority I would have. For me, it's, can you produce a good set of accounts? So I think that's what's important.
Thanks, Aidan. Lots of great questions coming in. I hope you have a glass of water, because you might need it.
That's all right.
Let's see what Beth and Ken have for us here from the group.
Thanks for that, Aidan. We can probably just jump in with probably one of the more difficult ones.
Okay.
We did a webinar ourselves last month, and we had a barrister, and she was talking about ADHD in the workplace. Her view was, why would you want to disclose?
Mm-hmm.
Our view is, when we do, like ourselves, we do talks to organizations on, neurodiversity in the workplace. And I would always say to them, it's a chicken and egg situation. Unless people disclose to you, you can't put in the reasonable accommodations. But at the moment, particularly people with conditions like ADHD, other conditions like Tourette's, are simply afraid to disclose. So how do you solve that one?
So I think there's a few things here. From the perspective of an organization, you've got to start talking about it. You've got to get your senior leaders talking about it. You've got to align your policies. We had... I started my career in mental health 15 years ago. The conversation around talking about your mental health at work was very different than what it is now. And the same way, having a conversation around LGBT or the menopause or other kinds of things. So it's really important, number one, as an organization, you have a responsibility to create psychological safety, to create a good culture as a leader. And kind of, I think because many senior leaders aren't people with neurodifferences often in organizations, they kind of don't see the barriers because the system is designed for them. So in terms of the organization, you need policies, you need procedures, you need to start talking about it, you need to start telling stories, you need to start showcasing. I think from the kind of manager employee point of view, you know, if you're listening to this with a neurodifference and you're thinking, should I disclose? Look, Ken, as you said, a disclosure is not always a positive experience. So you have to kind of gauge internally whether you feel comfortable or not. But one of the things we hear a lot from line managers is what they want to hear from employees is, what are your challenges and what support can I help with your challenges? So going into your line manager and saying, look, I have ADHD, I haven't told you about it for the last 2 years, and now what are you going to do about it? Because here's the Equality Act, is going to get a very different reaction, because most people are not clinical professionals. ADHD, as you well know, Ken, has all kinds of variations and complexities. And I think that's where managers get very nervous. They think they have to be clinical experts. And what we say is, look, talk about this person's challenges. These are human conversations. You don't have to have ADHD to dislike 8 hours back-to-back Zoom meetings all day long. You don't have to have ADHD to dislike a noisy office or to stand up in a meeting, or you don't have to have dyslexia if somebody sends you a 20-page Arial 7 PDF that you can't edit or change. These are human conversations, in my opinion, not just condition-based conversations. So for me, that's what I would say. Normalize it.
Thanks very much for that. Beth, jumping in there?
Yeah, this Aidan maybe kind of touches a little bit on the idea of disclosing as well. As somebody here who's talking about working in a smaller company, and I wonders how these kind of initiatives would roll out in a smaller company. This person says, 2 things holding me back from discussing my neurodiversity with my employer. I work for a very small company with only 3 employees. There isn't a HR team. So would you have any advice for maybe kind of talking about these things in a smaller organization, or do the same principles apply?
Yeah, I'm just reading the second part of that question as well. So look, small companies like large companies, firstly, you have to think about your own psychological safety. Again, I would echo, if you are nervous about disclosing, what you could do is talk about your challenges and your differences rather than specifically your condition. But also for smaller employers, there are often supports available. For example, in the UK, there's access to work. Or what you can try and do is try and come somewhat prepared. So you might say, look, I'm making this disclosure. Maybe you want to send an email with some useful resources, actually laying out quite specifically what would be helpful. Maybe, there are different ways to go about it. But what I will say is, look, a smaller company, from what I've seen, can often just be more caring for their staff than a larger one. They just may not have those processes or procedures in place. So again, I don't mean to kind of avoid the question, because there aren't any hard and fast answers of yes, you should disclose, or no, you should not disclose. But generally what we say to people is, look, focus on your challenges and rather than your condition sometimes, if that's a nervousness for you. And, try and do some research or really help your manager saying, this is what would make the difference for me.
Okay. Just a question in there from Helen Kane. Oh, sorry, just disappeared there. It says this question: there's a move in the inclusion world to differentiate disability and neurodiversity/neurodivergent. Do you agree that a separate label is appropriate?
That is a very good question,
yeah,
which could be.
That's what I threw to you.
Thank you very much for that one, Helen. Yeah, I mean, so look, do I think a separate label is appropriate? I think this is a complex one because, number one, neurodiversity is not a universal experience. ADHD is not a universal experience. We have some members of our community who may only be mildly impacted by their neurodifference or will talk about their neurodifference in the context of a strength and a superpower, and this makes me who I am, and I'm really proud of it. There are other members of the community who might actually feel very severely impacted by their neurodifference, who don't think this is a superpower or a strength. And they often feel if we don't talk about the challenges, if we don't talk about this as disability and share those stories, we're not going to get access to funding and resources. And even Judy Singer, who is credited at coining the term neurodiversity, came out recently and said, look, neurodiversity is not a Pollyanna concept. Do I think a separate label is appropriate? Personally, I think I do, because many people I speak to with neurodifferences don't identify as being disabled. So if you label them as disabled or invite them to an employee resource group as a disability employee resource group, you may not be reaching that part of the audience. That's how I feel. The very much counter argument to that is organizations should have a pan-disability strategy. And if we start breaking off neurodiversity and having a neurodiversity policy and champions and allies, well, then do we need a policy and champion of allies for visual impairments, for hearing impairments, for all of these different things? So again, not to avoid the question, but that's certainly not one I think I'm going to be able to solve for you. But I think the reason neurodiversity was really formed was because many people with those neurodifferences felt they needed a different way of looking at their differences. But neurodiversity very much has its foundations in the social model of disability. So, the idea that what is disabling is often the environment around me rather than myself. And that's the kind of conversation we try and have with organizations.
Oh, thanks for that.
What do you think, Ken? Do you think it should be a disability? How do you navigate that in ADHD Ireland?
Yeah, I'm coming at it specifically from an ADHD perspective. We would see ourselves as 10 to 15 years behind where ASD is at the minute. And so we see ourselves trying to create the awareness. And again, people are, that was partly the bit behind my first question. People are still afraid to say, I have ADHD. There's an old saying, you probably heard it yourself, Asperger, Silicon Valley runs on Asperger's. There's we go out and talk to companies ourselves, and our experience is, if there's 1,000 people, they 50 people with ADHD and maybe 10 with ASD. They know everybody who has ASD. They don't know a single one who has ADHD. And so again, for ourselves, we see it much. I fully agree with what you're saying. Actually, sorry, is rather the short answer. But for ourselves to create the awareness around ADHD. And we do see ourselves plowing that furrow in terms of just creating awareness about what is ADHD and how you support it better.
Yeah. And look, I mean, in Lexxic, we call ADHD the double barrel shame, because not only do you have disorder in your label, you also have deficit. I mean, it's such a stigmatizing label in and of itself. But look, kind of to think more about this, I think what I would say is, focus on the barriers in your organizations, not necessarily trying to identify all of the conditions, because, many people won't have a diagnosis. They may not disclose. As Ken will tell you, many people get an ADHD diagnosis in their 30s or 40s or 50s, but they will understand what the barriers are. And something we may be slightly missing from this conversation as well is the idea of intersectionality. What if I am female and Black and gay and have ADHD? How does neurodiversity and disability label then? So rather than trying to get into this long discussions on labels, which you will never get millions of people to agree on, in my opinion, focus on barriers. Focus on actually, these are the kind of barriers that might be excluding people with differences in participating in our organization, and how do we address them?
Okay.
Anyway, let's keep it going.
Mm.
Thank you for tough questions. This is a good audience. You don't.
Well, we've a lot to get through here. I'm going to go back to the first question actually that came in from Tanya, and she says, as a psychologist specializing in neurodivergence, are there any tools I can use with my clients to help them consider how to maximize their strengths and minimize their challenges in an occupational context?
Yeah, I mean, the short answer is yes, Tanya. Far too much to kind of list here, but you know, generally the kind of tools we're talking about is an environmental adjustment. So you might be adjusting the environment, a computer monitor, maybe sensory sensitivity, something like a noise cancelling headphone, working from home, flexible working. There's a lot of assistive technology software out there now, like mind mapping, speech to text and text to speech. And often then there is kind of coaching and training and so on. But I'll put my email in the chat. Please do send me an email if I can give you more on that. It really depends on the individual and it really depends on the context.
Okay, take that. A simple question, but I think it might take a long enough answer. This comes in from Sam. Thanks for your presentation, Aidan. May I please ask you to discuss how organization culture can be changed?
Yeah, so look, I mean, for us, this is the thing that takes the most amount of work, but probably has the biggest difference. God, how can organizational culture be changed? So look, for us, what are the barriers? For me, I think there's a few barriers. The first is most people, when they hear the word ADHD, they think of a negative. They don't take a balanced view or a strengths-based view. They think of a negative. So I think in changing culture, you have to have conversations, you have to do education, you need to start changing outdated perspectives as to what neurodifferences are. Other positive things I think we've seen change culture is, you know, training and education for line managers. They are generally the custodians in your organization. I am often not interested in your policies, your procedures, your shiny documents. Put me in a room with 20 of your line managers and they will often tell me more about your culture than, you know, what you are presenting out. And other positive things for me is employee resource groups, putting in clear adjustments processes, holding conferences and events on the subject, and thinking about some of the systemic barriers. But, you know, I think there's no silver bullet for changing culture, and changing culture really depends on where your organization is and what it is ready for. So are you in a large public sector organization? Are you in a small tech startup? For me, that tells me very different things about how we might work in that organization or how you might change the culture.
Okay, thanks for that.
Great, thanks, Aidan. We'll plow on here through these questions. How, Dr. Lisa Rose Jensen says, how would you suggest that neurodiverse people can be driving force for change in the workplace? I've been enrolled at HEI for months, but no RAP in place still. I don't know what RAP is, maybe somebody, hopefully you do, despite a wonderful and detailed lexic assessment some months ago. And I worry that many of my neurodiverse colleagues would have left if they had to wait 6 months. And this is adding to the autism unemployment stats, which are already terrible. I've got the strength at the moment to campaign for change. What advice can you give?
Sure. So I think RAP is reasonable adjustments process. So Lisa, what you're talking, Lisa, what you're talking about is very common, not just in neurodifferences, but also in disability, that many people get workplace assessments, but then there are multiple barriers to actually getting those assessments implemented. I'm not sure why yours have taken 6 months. Sometimes with assistive technology, your IT department is saying no, sometimes the line manager isn't engaged. I mean, you know, how can neurodiverse people be the driving force for change in the workplace? I think, you know, by telling your stories, by sharing your challenges and strengths, you know, maybe by setting up an employee resource group or working with your excuse me, your HR team, your D&I team in relation to this. I think, you know, if you're waiting 6 months for your adjustments, I would really try and have a conversation, or we can have a conversation. I see you did your assessment through us, about the impact that's having on you, because I think a lot of organizations don't realize the impact it is having on employees. And, you know, we're talking with employees on, you know, knowledge economy, good salaries, and we're kind of leaving people for weeks and months on end underperforming in their job. And that's a loss for you and your own well-being, but it's also a loss for the organization as well. So that's what I would suggest, you know, but you shouldn't be left waiting 6 months for your adjustments. Sadly, it is all too common. Gail, I see in the chat you asked, what's the definition for a KPI? It's key performance indicator. Another word for a KPI is often OKR, which is objectives and key results. So it's kind of data you use to track, to measure success.
Okay, thanks. Just Tanya has responded back there to your answer. She was very happy with your answer, but what she was saying is, I'm not thinking about adjustments. I'm thinking about how people choose their occupational roles. And it is something that, you know, has come up for us, you know, over the years, you know, and people say, what's a good job for someone with ADHD? The answer is what they particularly like and good at from our perspective. But, you know, is there a way particular choosing or defining a good role that works for someone who has a neurodivergent condition?
So look, I think what's very important with you know, the conversation around neurodiversity or the conversation around ADHD is it is a label, and labels are helpful at telling us about the characteristics of a group of people. And we do need labels because we cannot process all of the information about everyone all of the time. But I think where labels become challenging is when we then label every individual with the characteristics of that label. So when people ask me this kind of question, you know, it's kind of like saying, you know, is HR a good job for a woman? Is bouncer a good job for a Black person? Is mathematics a good job for an Asian person? And the answer for me is like, you know, we really get into old-fashioned stereotyping there if we see it this way. So I don't personally recommend good jobs for people with ADHD, because my experience of people with ADHD is that they are radically different. And I think as a community, we do have to be careful of falling into stereotypes. For example, one of the big stereotypes in autism at the moment is the kind of recruitment program for the white, male, autistic, middle-class coder, engineer, you know, finance and so on. So it's not a question I ever really get into. I think, you know, there are characteristics of individuals, there are labels, but when we're working with an individual, if we're talking about being people-centered, we really have to listen to that individual, would be my perspective.
Okay.
Sorry, I'm just looking through the questions there. Okay, so we have a question here from Mark, who says, even though we're talking about 15%, other protected characteristics are more visible and therefore have a higher profile. How can we overcome this?
You know, I think a number of different things. Number one, in increasing awareness of the differences. You know, I'm sure, Ken, you will echo this. Sometimes we're referred to, someone is referred to us for a diagnostic or a screening assessment. It is absolutely clear ADHD, and you know, it's been missed their whole adult life by teachers, by parents, by educators, by workplaces. I think the other thing is, you know, why are we not talking about these? I think about these differences because we have a stigmatized view of them. And for me, changing the conversation is actually getting people to share stories, getting organizations to implement policies so that when people hear the words dyslexia, ADHD, autism, they don't jump to a negative, or they don't jump to a stereotype. And I think if you look at some of the progress we've had in the D&I movement, you know, if I was to ask you 20 years ago, this person works from home full time, this person is going through the menopause, this person is bisexual, you may have a very different perspective or response than you have today. And I think it's the same with neurodifferences.
There's a couple of questions in from Martin, and thanks very much, Martin, for putting all that information in about yourself. But just to go to the very start, you know, with regard to recruitment and promotion interview process, he talks about that, and how can adjustments be processed be put in place. I know you've talked a bit about that, but could you just maybe talk a bit about progression for people with neurodiverse conditions? Because it's not always the straight ladder up and down. It can be different ways that people with neurodiverse conditions want to progress within organizations.
Yeah, absolutely. So I think when it comes to progression and promotion, as you've said, Ken, it can be a very common point where a person's challenges can come to the forefront. You know, just an example of speaking to a retail client earlier today, and you know, they were saying, when people are on the shop floor, they're moving around, they're active, they're talking to customers, they're using their hands, they're using their body. But when they get promoted to management, they're reading a huge amount more documents, they're responsible for project management, they're responsible for all of these different things. So I think, you know, when it comes to adjustments, I think a lot of employers make the mistake of saying, we've gotten you your adjustments, here are your adjustments, and now off you go. I think it's very important that adjustments are reviewed regularly, maybe yearly. They're reviewed when a person starts a new role. And again, you know, for an employer, it may offer flexibility in some of those things that people find challenging. So we are going to promote you to a manager, but actually we're not going to require you to do the same level of documentation as another manager. That might be an adjustment. So I think, you know, don't see adjustments as a kind of a one-off thing. In the same way, you wouldn't say, well, I went to the gym for a year and now I'm healthy the rest of my life. Adjustments are something that have to be reviewed regularly. They have to be tweaked and changed. And I think especially if someone is starting a new role, it's a good opportunity for an employer to prepare them for the differences in that role and actually talk about the adjustments in a new context. It's such a common challenge and a common frustration that, you know, people who are thriving in one role, it's the promotion progression that becomes a barrier.
Thanks, Aidan. We might kind of wrap up with this last question, which is maybe a big question, but maybe a good place to finish it is that if Rhoda asks, where would be a good place to start with a neurodiversity strategy?
Oh, I think we had that one before, hadn't we, Becky?
Did we ask that already?
Did you not ask me that, Ken, or am I just imagining?
No, we didn't actually. I was going to ask that one if Beth hadn't. So I've been thinking about that question myself. You know, was he asking from a perspective of an employee or an employer? But you know, it is the question. You know, as you say, 15% of the population is neurodiverse, and there is a lack of knowledge and understanding out there. So, someone, you know, an employer walks in the morning and goes, "Oh, I've just heard one of my employees has dyslexia, dyspraxia, ADHD, ASD. What do I do? Where do I start?"
Sure. So, I mean, you know, when starting with the individual, I think it's very important the organization has an adjustments policy in place or an adjustments referral process in place. So if somebody works up the courage to come into your office and say, I have ADHD, you don't know where to go, you don't know what to do, they have to talk to 5 different people, nobody knows where the budget comes from, you need to get sign off on the budget, all of these things really don't make that person feel included and they belong and you're a priority to them. You know, for me, strategy, to kind of go back to that earlier slide, is about, you know, why does your organization exist? and what are you trying to achieve? And what are some of the big things in your organization that are going to happen in the next 2 or 3 years? Is it about talent? Is it about innovation? Is it about cost reduction? Is it about, and to try and align the conversation you're having around neurodiversity to the clear goals and targets of your executives. That's number one. If you don't have executive buy-in, if you don't have leadership buy-in, if you don't have leadership accountability, all of the research in D&I says you're having limited impact. So if you have an operational plan and an executive plan, for me, a strategy joins up the two of them, which is how do we plan to achieve that and where we go? And look, I would just echo some of the things I've said. You can look at the individual, you can look at managers, you can look at systemic change. But what I really would say is just start somewhere, particularly public sector clients. I have seen people write 2 years of consultation, a lot of documents, a lot of consultation. Just start somewhere. And I think by starting, you will find people with neuro differences come forward in your organization, or you will find people with relatives and children and partners and so on, and they can also really add to the conversation and add to your work.
Well, thank you very much, Aidan, for your time this evening. For me, it's been enlightening. I've really enjoyed it, but also looking at the questions and engagement from all of the people in attendance, I feel we could do it another hour. I mean, I could nip out there and have my dinner and come back in and listen for another hour. Sadly, we don't have that, but there has been such engagement. We really almost need extra time. So I wonder if we might arrange something again, but certainly it's been so useful, and I see a lot of thank yous coming through in the chat. Very useful presentation, because ultimately we're all seeking work, or we're in work, or maybe we're trying to support somebody get into work, and if workplaces can be more welcoming and more opening, everyone benefits. So you've given us a lot of food for thought this evening, and certainly a number of things to follow up on. Just one question, actually. If would you know of any tools that could help with strengths? Maybe a tool perhaps to help with identifying somebody's strengths in the workplace.
So, I mean, when it comes to identifying strengths, what we would normally do in Lexxic is we would either do a screening assessment or a workplace assessment. And that process is where a professional sits down with an individual and says, look, talk me through your job, talk me through this role. What do you enjoy? What do you find challenging? And so on and so forth. And out of that, we would make a recommended report. I mean, if you want to talk about strengths in general, one of the common profiling tools is called Strengths Finder. It's coming from the US. I don't tend to recommend online kind of screening tools for neurodifferences because the quality, reliability, validity just varies so radically. But, you know, I really think we find that a lot of people instinctually know what they're good at and not good at. What they're curious about is what kind of adjustments are in place, or how do I get the best out of me? How do I mitigate some of my challenges? So, you know, if you even type into Google types of adjustments for dyslexia, for ADHD, if you go to the ADHD Ireland website, you'll see lots of great examples in relation to ADHD. There is a lot of resource and information out there, and I'm happy to maybe send a few links as part of the slides as well.
Well, thanks so much, Aidan. I'm a devil. I had to get one final question in.
I saw that, Timmy. I saw that. You stopped everyone else and then you threw
listen.
That's the power of being the webinar host, though, right? So
absolutely. I'll be fired, I think, for the next evening. But anyhow, a big thank you to everybody, Ken and Beth as well, for comparing and hosting. And Aidan, again, thanks so much. And everybody, thanks for giving of your time of Thursday evening. We're back in the new year. We have Davida Hartman in January, last Thursday in January. Then we have Dr. Shunnad Anderson, looking at tics and Tourette's syndrome, Quona Rankin, looking at dyslexia. So, you know, there's a lot to look forward to. But in signing off, happy Christmas, everyone, and happy festive season, everyone. So take care and good evening.
Thank you, everyone.
Bye. Bye.
And
Thanks, Aidan.
just to say, Timmy, I've put my email in the chat if people have follow-up questions. If you haven't gotten value today, send me your angry email. I'm very happy to do what I can to help. All right. We're here to add value. So please do message me if I can do anything.
Thanks, Aidan.
Thanks, Aidan.
Thank you so much for having me, everyone.
Take
Have
care.
a lovely evening.
Bye-bye.
Bye.